and welcome back to this segment on our channel called Answering Your Most Google Medical Questions by Hada Gastro, and today's video is a super interesting one. So let's get started. So in today's video, we'll be answering the question, what do you need to know about sleep apnea? So sleep apnea is a serious medical sleeping disorder that occurs when a person's breathing is interrupted during their sleep. People with untreated sleep apnea stop breathing repeatedly during their sleep, sometimes hundreds of times during the course of a night. This means that their brain and the rest of their body may not get enough oxygen at several different points during this time. So there are actually two types of sleep apnea. The first one is called obstructive sleep apnea, and the second one is called central sleep apnea. So looking at that first one, obstructive sleep apnea, also commonly known as OSA, is the most common form of the two forms of sleep apnea and is caused by a blockage of the airway, usually when the soft palate in the back of the throat collapses during the sleep. So this is what one's normal airway would look like during sleep, and this is what actually happens in patients who suffer from obstructive sleep apnea. We have a blockage in this airway caused by the tissue of the soft palate in the back of the throat collapsing back on the airway during sleep. And then we have the second one, which is called central sleep apnea. So unlike obstructive sleep apnea, here the airway is actually not blocked, but the brain in this case fails to signal the muscles to breathe due to an instability in the respiratory control center, which is actually found in the brainstem. So approximately 1 billion adults aged 30 to 69 years worldwide are estimated to have obstructive sleep apnea. That's actually 1/7 of the entire world population. It is estimated that 936 million adults aged 30 to 69, men and women, have mild to severe obstructive sleep apnea, and 425 million adults aged 30 to 69 years have moderate to severe obstructive sleep apnea globally. The number of affected individuals was the highest in countries like China, followed by the USA, Brazil, and India. So the signs and symptoms of obstructive and central sleep apneas overlap, sometimes making it difficult to determine which type one may have. The most common signs and symptoms include loud snoring, episodes in which one stops breathing during sleep, which would be reported by another person, gasping for air during the sleep, awakening with a dry mouth, waking with the morning headache, experiencing a difficulty staying asleep, which is called insomnia, experiencing excessive daytime sleepiness, which is called hypersomnia, experiencing a difficulty paying attention while awake, and irritability. So there are quite a few risk factors for obstructive sleep apnea. The first one is obesity. So fat deposits around a person's upper airway can obstruct their breathing. Having a thick neck circumference. So individuals with thicker necks usually also have narrower airways. An inherited narrow airway. Many actually inherit a narrow throat or also have enlarged tonsils or adenoids, which can also block the airway, particularly in children. Another risk factor is being male. So men are actually 2 to 3 times more likely to have sleep apnea than women. However, women will increase their risk if they are overweight, and their risk also appears to rise after menopause. Being older, so sleep apnea also occurs significantly more often in older adults. So continuing with risk factors, we can also have a family history. So having family members with sleep apnea might increase an individual's risk as well. The use of alcohol, sedatives, or tranquilizers. So all these substances relax the muscles in the throat, which can often worsen obstructive sleep apnea. Smoking. Smokers are 3 times more likely to have obstructive sleep apnea than are people who never smoked. So smoking also increases the amount of inflammation and fluid retention in the upper airway that can also provoke an obstructive sleep apnea. Nasal congestion, so difficulty in breathing through the nose, whether from an anatomical problem or allergies puts one more at risk to develop obstructive sleep apnea. And finally, certain medical conditions. So congestive heart failure, high blood pressure, type 2 diabetes, and Parkinson's disease are some of the conditions that may increase the risk of obstructive sleep apnea. Polycystic ovary syndrome, hormonal disorders, prior stroke, and chronic lung diseases such as asthma can also increase one's risk. So now let's dive into some risk factors for central sleep apnea. So the risk factors of central sleep apnea include being older, so middle-aged individuals and older persons have a higher risk of developing central sleep apnea. Being male, central sleep apnea is more common in men than it is in women. Heart disorders, so having congestive heart failure increases the risk of central sleep apnea. Using narcotic pain medications, so opioid medications, especially long-acting ones such as methadone, increases one's risk of central sleep apnea. And finally, stroke. So having had a stroke increases one's risk of central sleep apnea too. And so how does one go about diagnosing a sleep apnea? So if one has symptoms of sleep apnea, they can get tested with two different tests. The first one is called a polysomnogram test or a PSG test, and the second one is called a home sleep test or an HST test. So in nocturnal polysomnography, here the individual is hooked up to a set of machines that monitors the heart, lung, brain, breathing, arm and leg movements, and blood oxygen levels while the individual is asleep. And from these assessments, a diagnosis can be applied. The other test is called a home sleep test, and this records fewer bodily functions than the PSG, including airflow, breathing effort, blood oxygen levels, and snoring to confirm a diagnosis of moderate to severe obstructive sleep apnea. And so now let's talk about some treatment options for sleep apnea. Number one is lifestyle changes. So part of lifestyle changes, we can recommend weight loss. 50% of all people with sleep apnea are overweight or obese, so slimming down even by a few pounds can often improve their symptoms. Number two is quitting alcohol and sleeping pills. So because these substances decrease the muscle tone in the back of one's throat, which interferes with airflow, quitting alcohol and sleeping pills can often be very beneficial. Number three is changing sleeping positions. So one often breathes much easier if they stay off their back. Number four is quitting smoking. So smoking increases the swelling in the upper airway, which makes both snoring and apnea worse. And number five is treating allergies. So nasal allergies swell the tissues in the airways and make them narrower, so it's harder to breathe. Continuing with treatment options, we now move on to option 2, which is continuous positive airway pressure, or CPAP. So for individuals who suffer from moderate to severe sleep apnea, the best treatment option for them is using a machine that delivers air pressure through a mask while they sleep. This is called CPAP. So with CPAP, the air pressure is somewhat greater than that of the surrounding air and is just enough to keep their upper airway passages open, preventing apnea and snoring. The third treatment option is oral appliances. So another option to treat sleep apnea is by wearing an oral appliance designed to keep the throat open. So most oral appliances are designed to open the throat by bringing the jaw forward, which can sometimes relieve snoring and help greatly in cases of mild obstructive sleep apnea. So the fourth option for treatment is surgery for sleep apnea. So some individuals may need surgery if they have a medical condition that makes their throat too narrow. The most common types of surgery in sleep apnea include nasal surgery. So this fixes nasal problems such as a deviated nasal septum. Then we can also try uvulopalato-pharyngoplasty, and this takes out soft tissue from the back of the throat and the palate, making the airway wider at the opening of the throat. We can also try mandibular, maxillomandibular advancement surgery, and this fixes certain facial problems or throat blockages that play a role in sleep apnea. And finally, we can also try a tonsillectomy. and this is a procedure that removes the tonsillar tissue in the back of the throat, which is also usually a common cause of obstruction in children with sleep apnea. And the final treatment option, or option number 5, is actually a variety of different techniques. So part of this is semnoplasty, and this is a minimally invasive procedure that can shrink and stiffen the tissue of the soft palate in the upper airway. We can also use a hypoglossal nerve stimulator. So a stimulator is implanted under the skin on the right side of the chest, with electrodes tunneled under the skin to the hypoglossal nerve in the neck and to the intercostal muscles between the 2 ribs in the chest. So the device is turned on at bedtime with the remote control, and with each breath the hypoglossal nerve is stimulated and the tongue moves forward out of the airway, and the airway is essentially opened in this way. And the last treatment option is medication. So drugs like solriamfetol, which is called Sunosi, can be used to treat the sleepiness that often also comes with sleep apnea. And that brings us to the end of this video on sleep apnea. Thank you guys so much for watching. Hope you found the presentation very interesting and informative. Please make sure to like, comment, subscribe and share. And please make sure you turn on your bell notifications so you'll be notified every time we have a new upload. If you would like to help us make better videos and content, you can also donate to us via PayPal. Take care, and thanks for joining me today as I explored the basics of sleep apnea.